Good afternoon, everyone. Welcome once again to MGM Healthcare's Facebook Live Kids Health Talk, a series of talks we try to have once a week from MGM Children's, the Department of Pediatrics and Neonatology at MGM Healthcare Chennai. These talks we try to bring you once a week from pediatric specialists, super specialists, and associated specialists on talks regarding children's health that we think that families and parents will find useful. These will continue to be on Facebook and YouTube for you to access whenever you need to. And please feel free to share this with anybody you think may find this useful. Um, do we thank you for your support for these talks so far. It has helped us to bring back to you many more talks of the same. If you have any questions during this talk, please feel free to enter in the chat box. We will get back to you at the earliest. Today, it is our honor to have with us Dr. Pilli Govardhan. Dr. Pilli Govardhan is a consultant neonatologist and pediatrician at our department of MGM Children's at MGM Healthcare. He comes to us with over 15 years of experience. And today he's going to talk to us about a very normal phenomenon that all parents and families would have experienced, the normal development of children. Most of you as parents and families would understand how interesting it is to see a baby grow from the time that they are born and all the developmental milestones they cross as they become 2 to 3 year old toddlers, become older children, go to school. It is so interesting to see them grow and learn these new skills, and especially in the early years where they learn so many new skills so often. So Dr. Govardhan is going to talk to us about what is normal, what should we expect as normal, when should we be concerned. These are the questions Dr. Govardhan will be answering this time. Welcome, Dr. Govardhan.
Yeah, thank you, ma'am. Thank you for introduction. I like to thank MGM Healthcare giving me this opportunity, and also thanks to parents who is participating in the session. Today, my topic will be about the child development and their milestones, and I'm going to talk both languages, in English and Telugu, because I have some of the patients Telugu.
Thank you, Dr. So, before I start, what overall idea of what this development is like, what is the expectation for the children, why is it important?
This is very important. First of all, I'm going to tell the overall view about the development. And when parents, grandparents, and other caregivers will and their milestones, if they found any delay in milestones, and when they are going to their pediatrician for a vaccination or general health checkup, always discuss with the pediatrician. And one more thing is that as a pediatrician, when I'm going to look for milestones, whenever they come for vaccination, like at 6 weeks, 10 weeks, at 14 weeks, 6 months, 9 months, 1 year, till 5 social and language milestones. In this, if I found any delayed milestones, I may give some more time. If still baby is not attaining that milestone, I always suggest the parents. And in MGM Healthcare, we have a child development unit. In that, we have developmental pediatrician, occupational therapist, psychiatrist, physiotherapist, all of them. When we will refer to them, they will assist the child and they will give the guidelines, the plan of action. I always advise the parents strictly follow their advice, and when again come back to pediatrician and we'll follow the child and we'll see there is any improvement or need assistance or any help. And mostly I have observed some of the parent they won't accept, but always my sincere advice to accept. Early recognition and early intervention will give the good prognosis. మీరు ముఖ్యంగా తల్లిదండ్రులు ప్లస్ గ్రాండ్ పేరెంట్స్ ప్లస్ కేర్ గివర్స్ వాళ్ళు ఎక్కువగా క్లోజ్గా అబ్జర్వ్ చేస్తారు చిల్డ్రన్ని. ఎప్పుడైనా ఏదన్నా ప్రాబ్లం ఉంటే, డిలే ఉంటే, లైక్ మాట్లాడటంలో కానీ నడవడంలో కానీ అన్న ప్రాబ్లం ఉంటే మీరు పిడియాట్రిషియన్ దగ్గరికి తీసుకెళ్ళినప్పుడు వాళ్ళకి చెప్పండి. యాజ్ పిడియాట్రిషియన్గా మేమేం చూస్తామంటే ఎప్పుడైతే వ్యాక్సినేషన్కి వస్తారో ఫస్ట్ 6 వీక్స్ నుంచి 5 years వరకు, అప్పుడు మైల్స్టోన్స్ ఏమైనా డిలే ఉంటే దాంతో ఒక చైల్డ్ డెవలప్మెంట్ యూనిట్ అని ఉంటుంది ఇప్పుడు లైక్ MGM Healthcareలో, దానికి రెఫర్ చేస్తాం. వాళ్ళు అసిస్ట్ చేసి మీకు క్లియర్ కట్ గైడ్ లైన్స్ ఇస్తారు. దాన్ని స్ట్రిక్ట్గా ఫాలో అయితే బెటర్ ప్రోగ్నోసిస్ ఉంటుంది చిల్డ్రన్స్లో.
Thank you very much, Dr. Govardhan. That's very important advice and information. Why we development milestones and why it's important to pick it up early, because early intervention we know really helps children. So going forward, let's go step by step over these developmental milestones over the first 5 years. Although children do develop considerably over up to teenage and adolescence and adulthood, we are going to cover in this session only the development of children up to the age of 5 years. So, in the first year, Dr. Govardhan, could you give us an overview of normal development of children in the first year?
Yeah, this first year developmental milestones is very important because most of the growth of the brain, 70% of brain growth happens at first year of life. And I'll start my developmental milestones examination at 6 weeks because that is the time they are going to come vaccination to me. At 6 weeks, mainly we'll put what are the milestones I'm going to see at. I'll put the baby on ventral position. Ventral position means I'll put baby on abdomen, my under my above my palm, and then see they try to lift their head. If I put the baby on prone position, they try to lift the chin, and when mother is talking to baby, they can respond with the smile. This is the milestones at 6 weeks. And the next milestone is at 8 weeks. Here also same thing. If you are putting in ventral position and prone position, they try to lift their head in midline, and so some more prolonged time they can keep the head up. And one more thing, whenever mother is talking to baby, they can respond with the social smile. This is the main milestone at 8 weeks of life, and they can vocalizing like a cooing sound. This is the 8 weeks of life. Another thing is 3 months of life. 3 months of life, they have main milestone is head control. What is the head control means? When you are putting in prone position, child may lift the head in prolonged period. When you make the child full to sit, then head won't fall backside. This is called as a head control main milestone. And one more thing at 3 months is they try to turn from backside to front side. We call as a from supine to prone position. Other milestones is they have hand regard. They will play with their own hands. They come to try to combine their hands and they will play. This is other one. And one more thing is they try to follow the dangling objects at 3 months of life. And next milestone is at 6 months of life. They sit with when we are supporting no, a child, they'll try to sit. And other milestone they have is a stranger anxiety. Whenever they see new people at home, and they try to cry, or they try to show their anxiety, that is called as a stranger anxiety at 6 months of age. And one more thing is when you take the cup towards their lip, they try to drink water from cup, and they try to laugh loud when they're showing mirror image. These things can happen at 6 months of age. At 9 months of age, they can try to stand without support. They try to sit without support. They try to stand with support, and try to pick the things from fingers. Like you are keeping food in front of them, they can try to pick the food from fingers and try to chew it. That is the 9 months. At 1 year of age, they try to stand without support. If you are supporting with one hand, they can try to walk, and they can try to speak 2 to 3 words with meaning. And this is the milestones happens at first 1 year of life. అండ్ అట్ తెలుగులో 6 వీక్స్లో వచ్చి పిల్లల్ని ఎప్పుడైతే మనం బాళ్ళు పండబెట్టినప్పుడు వాళ్ళు ఏంటంటే తల లిఫ్ట్ చేసేదానికి చేస్తారు. మదర్ మాట్లాడినప్పుడు వాళ్ళు స్మైల్ తోటి రెస్పాండ్ అవుతారు. ఇంకోటి 8 వీక్స్లో వచ్చి సోషల్ స్మైల్ అంటారు. మదర్ మాట్లాడినప్పుడు సౌండ్ చేయడం, కూయింగ్ సౌండ్ చేయడం, సోషల్ స్మైల్ చేయడం ఇది చేస్తారు. ఇంకోటి వచ్చి 3 months ఏజ్లో వచ్చి హెడ్ కంట్రోల్ అంటారు, తన నిలబడడం అంటారు, అది చేస్తారు. ఇంకోటి వచ్చి చేతులతో ఆడడం, ఇవన్నీ చేస్తారు. ఏమన్నా ఆబ్జెక్ట్ చూపిస్తే దాన్ని చూడడం, ఇవన్నీ చేస్తారు. ఇంకోటి 6 monthsలో అయితే మనం సపోర్ట్ చేసినప్పుడు కూర్చునేదానికి ట్రై చేస్తారు. ఇంకోటి వచ్చి ఎవరైనా కొత్త వాళ్ళని ఇంట్లో చూసినప్పుడు ఏడవడం, అవన్నీ చేస్తారు. ఇంకోటి వచ్చి మిర్రర్లో చూపించినప్పుడు నవ్వడం, ఇవి చేస్తారు. 9 monthsలో వచ్చి మీరు వితౌట్ సపోర్ట్ వచ్చి కూర్చుంటారు. విత్ సపోర్ట్ చేస్తే నిలబడతారు. ఇది ఇంకోటి వచ్చి ఫుడ్ ఏమన్నా వాళ్ళ దగ్గర పెట్టినప్పుడు ఫింగర్ తోటి పిక్ చేసేదానికి చూస్తారు. 1 yearలో వచ్చి వితౌట్ సపోర్ట్ వాళ్ళు నిలబడడానికి ట్రై చేస్తారు. ఇంకోటి వచ్చి 1 yearలో వచ్చి ఒక 2 to 3 words మీనింగ్ వర్డ్స్ వచ్చి మాట్లాడడానికి ట్రై చేస్తారు. దిస్ ఈస్ ది ఫస్ట్ 1 year ఆఫ్ లైఫ్.
Thank you very much, Dr. Govardhan. Thank you very much, Dr. Govardhan. That is really very useful to know these milestones. Now, just asking. So there are some things called red flags. What particular concerns of at developmental stages should parents talk to the pediatrician?
Yeah, there is no clear guidelines about the red flags, but some of them is given guidelines. That is mainly if child is not fixating eye at 2 months of age, not vocalizing at 6 months of age, at not sitting without support at 9 to 10 months. This is the first tier of life red flags. But there is no clear cut guidelines. Anyway, we are going to, as a pediatrician, we are going to assess the full developmental assessment and give the advice to parents, and they can follow those guidelines.
You're very right, Dr. Govardhan. Although there are no clear-cut guidelines, it just gives us parents a understanding of what should be a concern and families. So if they realize a child has not attained that particular milestone, it is good to check with the pediatrician. Thank you very much. So going forward to the next age group, 1 year to 3 years. 3 years is around the time that they enter LKG. And what should parents expect at the developmental milestones from 1 year till the age of 3 years? Could you give us an idea?
Yeah, this is another important question, and as I already explained about 1 year, I'm going to start from 15 months. So that is the time they are going to come for vaccination. At 15 months of age, they'll creeps upstairs and they walks alone, but sometimes they may fall. They can no, self-eating. They can pick up the cup and drink water and put it down. And one more thing, they can speak at least 6 words. They can throw objects. This is the milestones at 15 months of age. Next milestone is 18 months. At 18 months, they can walk without support. They can downstairs and upstairs, means they try to walk. And other thing is at 18 months, they can speak at least 10 words. This is the milestones at 18 months. At 2 years, what will happen? They can try to walk upstairs and downstairs with 2 feet per step. And one more thing, they can try to make speak sentences at least 2 to 3 sentences at 2 years of age. They can try to wear the shoes, socks, and pants at this age, and they can ask for food and drink at 2 years of life. At 3 years, they can ride the tricycle, and they can walk upstairs and downstairs with 1 foot per step. And one more thing, at 3 years of age, they can no, dress and undress can do at 3 years of age. They can ask consistently ask questions at 3 years of age. They can copy the circle at 3 years of. This is the milestones between 1 year to 3 years of life. 1 ఇయర్ నుండి ఒక సంవత్సరం నుండి 3 సంవత్సరాల వరకు ఏంటంటే ఒక 15 మంత్స్కి వాళ్ళు వ్యాక్సినేషన్కి వచ్చినప్పుడు మనం చూస్తాము. 15 మంత్స్లో మెయిన్ మైల్‌స్టోన్ ఏందంటే పిల్లలు నడుస్తారు. వితౌట్ సపోర్ట్ లేకుండానే నడుస్తారు. నీళ్లు తాగడం గానీ, ఫుడ్ వాళ్ళు సొంతంగా తినడం గానీ, ఇవన్నీ చేస్తారు 15 మంత్స్‌లో. ఇంకోటొచ్చి 18 మంత్స్‌లో వచ్చి వితౌట్ సపోర్ట్ వాకింగ్ చేసేదానికి ట్రై చేస్తారు. అండ్ ఇంకోటి థ్రోయింగ్ ఆబ్జెక్ట్స్, వస్తువులు విసిరేయడం అవన్నీ చేస్తారు. ఒక 2 ఇయర్స్‌లో ఏందంటే మెట్లు పైకి, కిందకి అంటే 2 ఫీట్ పర్ స్టెప్ ఆ మాదిరిగా నడవడానికి ట్రై చేస్తారు. ఇంకోటొచ్చి 3 ఇయర్స్‌లో ఏందంటే ట్రైసైకిల్‌ని రైడ్ చేసేదానికి ట్రై చేస్తారు. ఇక్కడ డ్రెస్ ఏసుకోవడం ప్లస్ ప్లెంటీ ఆఫ్ క్వెషన్స్ వాళ్ళు అడుగుతూ ఉంటారు. ఇది 3 ఇయర్స్ ఆఫ్ ఏజ్. దిస్ ఈస్ ద మైల్‌స్టోన్స్ బిట్వీన్ 1 to 3 ఇయర్స్.
Thank you very much, Dr. Govardhan. Again, a very clear picture of what happens and how children develop up to the age of 3 years. So, in this age group, are there any red flag signs again? Anything that parents should be concerned about?
Yeah, as I said earlier, there is no clear-cut guidelines about red flags. This is totally we are observed by pediatrician. After examination, we will give the advice. But there is some guidelines saying that about the red flags that any child is not sitting without support at 16-month age. At there is no single word at 18 months of age. At there is one more thing is. there is no imaginatory play at 3 years of life. This is the red flags at first 3 years of life.
Thank you very much, Dr. Govardhan. That gives parents a good idea of what to expect and what to be concerned about. So going forward, the next milestone, next age group we're looking at is between 3 years to 5 years. Could you tell us about this age group between 3 years to 5 years, what to expect as normal development?
Yeah, this is another important question. To 3 years mainly, so I will already I explained about 3 years. I am going to start at 3.5 year. At 3.5 year, they can copy the bridge and name 10 words and imagine imaginary companion. These things can happen at 3.5 year. At 4 years, they can climb the upstairs and downstairs 1 feet per step, and they can ask no they can tell stories, they can name the 4 colors, they can eat food themselves, and they can have dry at night, dry at day and night also. This is at 4 years of life. At 5 years, no, mostly they can skip with both feet, and one more thing, they can speak sentences, and they can repeat the sentences with no 10 syllables. All these can they can do at the 5 years of life. This is the milestones between 3 to 5 years of life. తెలుగులో వచ్చి 3.5 yearలో వచ్చి వాళ్ళు ఏంటంటే బ్రిడ్జ్ కాపీ చేయడం అలా చేస్తారు. ఇంకోటి వచ్చి 4 yearsలో వచ్చి స్టోరీలు చెప్పడం, లేకపోతే స్కిప్పింగ్ 2 ఫుట్ తోటి చేయడం, ఫుడ్ వాళ్ళు సొంతగా తీసుకోవడం, కలర్స్ ఏవైనా 4 కలర్స్ చూపిస్తే నేమ్ చెప్పడం, ఇవన్నీ చేస్తారు. 5 yearsలో ఏంటంటే స్కిప్పింగ్ విత్ బోత్ ఫీట్తోని చేస్తారు. మళ్ళీ అది కాకుండా ఏమన్నా సెంటెన్స్ ఉంటే రిపీట్ చేయడం అలా ఆ మాదిరిగా ఇది 5 yearsలో దిస్ ఈస్ ద మెయిన్ మైల్ స్టోన్.
Thank you very much, Dr. Govardhan. So going forward, we there is this condition called autistic spectrum disorder, where children don't attain some of these milestones. You sometimes often picked up around 1.5 to 2 years. Could you tell us something about this?
Yeah, this is we have oftenly means we have seen some children whenever they come for vaccination or general health checkup. This autistic spectrum disorder starts as always less than 3 years of life. What will happen in ASD, mainly that qualitative impairment in verbal and non-verbal communication. They have imaginative behavior, and one more thing is a reciprocal speech and poor eye contact. All this they can do at autistic spectrum disorder, and they are unable to engage with communicate with parents or caregivers. This mainly is a multifactorial or genetical cause. Then with this, if you are once you diagnose with autistic spectrum disorder, those children need to be monitored closely, and they need actually intensive behavioral therapy, speech and language therapy, one-to-one teaching. They need to teach communication skills. You can use different tools and techniques. These things to be needed. Again, as I said earlier, we can refer to child development unit and we can make a plan. And as a parents, you have to follow strictly guidelines. And it can peaks between 3 to 6 years also, but in the slowly it will subside. ఇంకోటి వచ్చి ఆర్టిస్టిక్ స్పెక్ట్రమ్ డిజార్డర్ ఏంటంటే 3 సంవత్సరాల కంటే తక్కువ ఉండే పిల్లల్లో ఎక్కువగా చూస్తుంటాము. దీనివల్ల ఏంటంటే వాళ్ళ వచ్చి పూర్ ఐ కాంటాక్ట్, సరిగా పేరెంట్స్తో మాట్లాడకపోవడం, ఒంటరిగా ఉండడం, అర్థం లేని మాటలు మాట్లాడడం, ఇవన్నీ చేస్తుంటారు. దీనికి ఏంటి రీజన్ అంటే ఒకటి జెనెటికల్ కావచ్చు, ఏదైనా మల్టీ ఫ్యాక్టరీల్లో. దీనికి ఏంది మనం ఎలా మేనేజ్ చేయొచ్చు అంటే వాళ్ళకి వచ్చి బిహేవియరల్ థెరపీ అంటారు, దాన్ని చేయొచ్చు. ఇంకోటి ఏంటంటే 1-to-1 టీచింగ్ చేయాలి. ఇంకోటి ఏంటంటే వాళ్ళ కమ్యూనికేషన్ స్కిల్స్ పెంచేదానికి డిఫరెంట్ టెక్నిక్స్ ఇవన్నీ యూజ్ చేయాలి. యాజ్ నేను ముందు చెప్పినట్టు చైల్డ్ డెవలప్మెంట్ యూనిట్కి రెఫర్ చేసినప్పుడు వాళ్ళు అసిస్ట్ చేసి మీకు అడ్వైజ్ ఇస్తారు, దాన్ని ఫాలో అయితే చాలు.
Yes, thank you very much, Dr. Govardhan. So it's important to pick up these little symptoms and signs of children who are not making very good eye contact, whose vocalization is poor, they're not reciprocating, they seem to not hear when you call them. So it's important to pick these up and definitely attend to them, because many of them do very well with early intervention. So thank you very much. So going forward, talking about some normal behaviors that happen in children that sometimes parents are unable to understand why it's happening and how to deal with it. Things like temper tantrums. So, could you tell us more about these children?
Yeah, actually, it's a temper tantrum is actually usually normal behavior, but as a parent, no, you always feel that is abnormal when you are handling the child. Temper tantrum always starts at less than 3 years of age, but you can recognize early as at 18 months of age. In temper tantrum, child they start doing autonomous themselves, and they start separating from the primary caregivers. When they cannot show their autonomous, they will show their anger and frustration, like hitting, biting, and throwing objects and banging their head. All this called as a temper tantrum. In during temper tantrum, that as a parent you should be calm and quiet, and always you have to protect your child from self injury or injuring to others. Always make them quiet and silent environment, and you have to put the time out, at least give 3 to 5 minutes. And when they calm down, you have to welcome them in a social group, like with a hug or a lot of care and love. Then so that they will be calm, but it can peak at 3 to 3.5 years, but slowly, once they start growing up at 4 years, 5 years, it will maybe subside. It is a normal behavior in temper tantrum, nothing to worry about that.
Are there any other of these normal developmental behavioral features of children that parents should know
Yeah,
about?
one more we'll call as a peak. That is what will happen. Some children may eat that non-nutritional substances like charcoal, chalk no paint, all those things. No, but that also is normal. But at the same time, we have to evaluate. Sometimes, if child having anemia and these conditions, they can develop these things like habitual. We'll call as a habitual disorders. But as a once you bring notice to a pediatrician, they will evaluate, and they will give the treatment. And other thing is thumb sucking. Thumb sucking is a normal behavior, but I have observed some of the parents, what they do, that they will forcefully remove the finger, and they will try to scold. You should not do those things. And some parents, they used to apply neem oil, and those things, it will get trouble for children. You should not do. By age they will learn, and you have to motivate them, and slowly they will stop doing that one.
Thank you, Dr. Govardhan. I think the importance of knowing these normal behaviors is also how as a parent you should be prepared how to manage it. If you get angry, if you get angry with the child, it really doesn't help because these are all normal phenomena. It's good to know how to manage each of these things in a calm way and in a loving way. So, as as I understand, while we were preparing for this talk, you had a discussion with one of our development pediatricians, Dr. Abhinaya, and she was very she considered it very important for us to discuss two particular aspects about normal development. So she had talked to you, I understand, saying what is a good home environment for children to develop normally. So could you tell us something about this?
Yeah, this is very important in child development, any child, because that your home environment should be calm and loving and caring environment. You should not distract the with the children. And some parents, they may always shouting at children not doing homework or not doing other things. Always make them understand. You always explain difference between bad and good, and allow them to play at outdoors. And some of the parents, mainly during this lockdown, either parents or children always more exposed to gadgets, like almost per day, I think maybe 10 hours, 8 hours, always watching TV, gadgets, mobile tab. That is not good for children. Sometimes it may have development, means speech delay, language delay, all those things. That's why better to avoid using gadgets exposure. And one more thing, how should be clean and neat environment. always encourage your child to to do creative things and innovative things, those things, and always help them to solve the problems. Always encourage them, not to discourage, and always talk with love and affection. These things make small things can make home environment will be better, and then it will impact on child development.
Thank you, Dr. Govardhan. It's really very important points. As you know, we are all quite addicted to our mobile phones. So often, as parents and grandparents and families, you find that children are playing these days while the adults continue to look at their phones. So this distracted environment is certainly not good for the development of children. And really, to reiterate how many times that it's important to interact with our children and play with our children. Thank you very much for those three pointers. I hope it has been very helpful to parents. Going forward, uh, let's look at a specific. Dr. Abhinay was also telling us about device and gadget use in children. So I think the American Academy of Pediatrics has some guidelines. Please tell us about them.
Yeah, this American Association of Pediatrics given some guidelines about the media exposure. What they are telling that less than 2 years, you should not, any child should not be exposed with any gadgets except video chatting. That's what they are telling. And next guidelines is preschoolers, they are allowing for only 1 hour. If school going children or teens, they can use 2 to 4 hours per day, but it should not affect on your play or exercise and family meals, all those things, quality things you should not miss. That's what they are advising. And one more thing, minimize the media exposure. What means we know that some parents, they can keep TV in children bedroom. It should not be done. That's what they're telling, minimize the media exposure.
Thank you very much, Dr. Govardhan. So that comes to the end of our talk. Thank you very much for that. A lot of good advice and a lot of good pointers. So I think we have a few questions that have been asked in the chat box. Can I start with those questions? So I think one of our viewers has asked, my child is 20 months old. What can I expect as normal development for my child?
Yeah, as I told, at 20 months now, 1.5 year, they should walk alone without support, and they can take food, when you are offering. And one more thing, they can at least speak at least 6 to 10 words. These things are no is normal. And but if there you feel if there is any delay or anything, but no, don't worry, but you can bring to pediatrician and we will see and we will examine, and then we will give the advice for you. Yes.
Thank you, Dr. Govardhan. Another of our viewers has asked, is it a concern if an 18-month-old is not saying more than a few words?
Yeah, as I told that at least they has to speak at least a single word at 18 months. If it's not at all speaking, that means that there is some speech delay. And you can always just contact pediatrician, and we have speech and language therapy, and they will counsel the parents how to educate, how to behave with children, all those things. They will train you, and you can follow those guidelines. I think mostly they will improve with the training.
Thank you very much, Dr. Govardhan. I think there are no further questions. Thank you very much, both. I hope viewers that those answered your questions. If you have any further questions, please feel free to enter it in the chat box. We will answer your questions. It is important, I think, to say that approaching a pediatrician to understand, is this normal development? Can we intervene early? And then we have this child development unit, as you said, and early intervention is key. So recognition and early intervention is the important thing. Thank you very much. Viewers, thank you for your participation. Please join us again next month for Facebook Live's Kids Health Talk. Thank you very much.
Thank you once again, all the parents who participated in the session.